So in honoring John Hauser's memory, I hope you'll let me share another story that got us involved in this work about 4 years ago. The pilot on the right's name is Paul, and Paul is a senior airline pilot at a major U.S. air carrier in the United States. He's a couple years from retirement and a lifelong runner with a favorite pastime of jogging when he's on layovers around the world. The pilot on the left is Stephen, and Stephen happens to fly the same airplane for the same airline, and these gentlemen are brothers, both lifelong lovers of aviation, both dads with kids, and both lovers of aviation. Well, a couple of years ago, Paul was out for one of his jogs and noticed that he was beginning to get some chest pain. Now, the pain went away when he rested, but it kept recurring every single time he went out. He thought about getting it checked out, but worried about what it would mean for his ability to finish out his career, continue flying, and of course retire. Well, unfortunately, not too long ago, Paul was out for a run and the pain came, but this time it was different. And he made it home, but unfortunately he suffered a heart attack and passed away in his kitchen. Stephen, his best friend, actually suffered a lifelong history of major depressive disorder and never sought treatment for it for his fear of losing his medical certificate, his ability to fly and provide for his family. Well, the passing of his brother was kind of the last straw, and unfortunately he died of suicide. So what happened here? The views expressed in this presentation are mine alone and do not necessarily reflect those of the Air Force, and I have no relevant conflicts of interest. So let's take a step back. Paul and Stephen are among the somewhere around 630,000 pilots in the United States that function in one of the most complicated systems that humans have created, and that's the aerospace system, that allows for the safe transport of somewhere around 2.2 million people a day, not to mention about 150,000 general aviation aircraft, and among many other types of operations. And the way that this system is really able to achieve this really remarkable feat is in part related to federally mandated aeromedical standards. That is, certain pilots, based on their flying duties, are required to meet certain standards. And of course, these standards are pretty well laid out in the Aeromedical Guide and in policy. And in the United States, an aeromedical examiner, who is a physician in the community who does not usually work for the FAA, is charged with evaluating to see if these pilots meet these minimum standards. Now, if a pilot develops a new condition or a new symptom, and the AME determines that these minimum standards aren't met, of course, as we all know, the pilot runs the risk of temporarily or permanently losing their medical certificate. But here's the kicker. If a pilot develops a new symptom or a new condition, they are to self-identify, take themselves off of flying duty until you get it checked out. Now, of course, in theory, this system should work, right? When pilots are healthy, they fly, and when pilots are not healthy, they don't fly. And that perception may be supported in part by a proportion of pilots and a proportion of the general population viewing pilots like this. Superhumans that don't get any medical conditions. Well, unfortunately, it may not be so simple. In fact, pilots may not only get the same medical conditions that the general population gets, but they may be at particular risk for certain conditions specifically because of their status as a pilot. This systematic review article showed that pilots may not only have the same prevalence of depression as the general population, but actually may have higher rates of depression compared to the general population. And this was a study across pilots across the world. And of course, these findings were not only established in mental health conditions. In fact, recent other studies have demonstrated similar findings in coronary artery disease, melanoma, and neuroimaging abnormalities. And these findings may have consequences. This review article of all aviation accidents that resulted in death in the United States showed that 5% of them were specifically attributed to a medical condition that the pilot never told anyone about, meaning that there is a small portion of aviation accidents that are due to a condition that the pilot never mentioned. Well, circling back to our pilots, they may not be alone, but as a physician who cares for patients, it's hard not to ask the obvious question. Coronary artery disease is a treatable condition. Major depressive disorder is a treatable condition. So why did these two gentlemen die so young of treatable conditions? Well, it's my suspicion that a proportion of people in this room have a reflexive answer to that question, and that's that pilots are afraid to go to the doctor because they're afraid of losing their medical certificate. But while that perception is often common knowledge to pilots and the physicians that help care for them, remarkably, that perception is not well described in the medical literature. That is, the issue that brings us together has really not been that well researched. And so our group set out to try to answer some of those questions. Do pilots have healthcare-seeking anxiety? To what degree does this exist? And what does this mean for behavior day to day? And as we began to kind of pull at this story, we really came across a really fascinating narrative about a problem that is staring us square in the face. But we think that this data may not only be giving us a lens by which to approach this issue, but may be giving us hints about what a solution might look like. So in this presentation, I'm hopeful that you'll leave with these three numbers, and I will talk about each in turn. So in our first study, published in 2019, with about 850 people involved, we asked the obvious question: have you ever felt worried about seeking medical care because of your career or hobby? So the aviator cohort was mostly airline pilots, but had a nice mix of different pilot subtypes. And we found that almost 80% of pilots answered yes. Now, while this number may not be surprising to a subset of folks in this room, to our knowledge, this is one of the first numbers published trying to define the prevalence of such an issue, knowing that there are limitations. And by extension, if pilots are about almost 80%, what about non-pilots? And we found just about 30% of pilots, non-pilots, answered yes. So really a marked difference. Well, by extension, if pilots have healthcare-seeking anxiety, we then asked them, have you ever delayed medical care or not sought medical care specifically because of your fear of losing your certificate? Meaning that they had a symptom and they either waited to check it out or they checked it out. In our cohort, we found about 60% of pilots answered yes. So in looking at this number, it's hard not to ask, could there be up to 50% of pilots in the United States flying with this symptom that has not been fully evaluated? Now, certainly these types of studies absolutely have their limitations, and certainly any conclusions should be drawn within that context. But we think that these data support the hypothesis that healthcare-seeking anxiety exists. And when this first study was published, we came across so many more questions. Well, if pilots have healthcare-seeking anxiety, what does that mean for their behavior day to day, and what does this mean for operational behavior? So in our second study that just wrapped up was a tremendous effort with the help of many people that we're very grateful for, to include Sun Country Airlines and, of course, United Airlines, so a huge thanks to them, the Civil Air Patrol and the FAA. Also, we definitely want to thank General Thomas Travis, who is the past Surgeon General of the Air Force, and Major General John DeGoes, who is the current Deputy Surgeon General, who helped get this study in the hands of pilots in the military across the world. And the paper is currently under peer review at JAMA Network Open, and because of this effort, we were able to enroll over 4,000 pilots. To our knowledge, the largest study ever conducted on pilot healthcare-seeking behavior. And here's what we found. If pilots have healthcare-seeking anxiety, we were curious about whether or not they have participated in unauthorized behavior. And so this is how we defined it. We asked pilots, have they ever participated in any one of the following? Have they ever sought informal medical care, meaning that they went outside of the traditional medical system, they talked to their buddies, they went to the internet, they went maybe to some kind of alternative practitioner to seek either counsel, guidance, and disposition advice. Have they ever maybe not told the whole truth on aeromedical screening, or maybe they did not fully disclose something on aeromedical screening? Then we asked them, had they ever had a symptom, psychological or physical, that they felt should have been checked out by a physician before flying, but flew anyway? And last, had they ever used a prescription medicine that they never told anyone about? Well, this is what we found. In our study, to our knowledge, the largest ever done on pilot healthcare-seeking behavior, mostly airline pilots, but a nice mix, what percentage of pilots freely disclosed that they had participated in unauthorized behavior? If the purpose of the aeromedical system is in part to screen pilots to see if they are meeting a minimum standard, are we achieving that? So let's dig into the numbers. I invite you to turn to your neighbor, and I invite you to make a prediction. What percentage of pilots would you predict have sought informal medical advice outside of the medical system? And what percentage of pilots would you predict have misrepresented or withheld information on aeromedical screening? So I invite you to turn to your neighbor and if you'd like, share a prediction. All right, so in the essence of time, Dr. Bierke wanted to make sure, she's keeping me honest, so I appreciate that because I can go on and on. What I'm very curious, and of course, as an aside, your participation in that QR code survey on your desk would be a gift, and we'd really appreciate if you consider doing it. But what I invite you to do is go ahead and I invite you to raise your hand if you would predict less than 25% of pilots have sought informal medical advice. So no hands went up. Okay, how about 25 to 50%, maybe less than half? Any takers there? Okay, for our folks at UND, no hands. How about greater than 50%? That's going to be the last category. Okay, so I think almost every hand is up, so that is interesting. Well, in our cohort, this is what we found. We found that about 45% of pilots admitted to going outside of the medical system to seek medical advice, to seek counsel on disposition and next steps. And by extension, if they're seeking informal medical advice, where are the pilots going? This is what we found. Pilots are going to the internet. Pilots are talking to other pilots. People are talking to their family or friends. They're going to their chiropractor. They're going to their dentist. They're going to their alternative healer. Anywhere to try to get some medical guidance. Now, this is just kind of interesting. It's kind of interesting to know where pilots are going. But most importantly, in a world of limited medical resources, perhaps these are the avenues that we could talk about the application of interventions to intervene, knowing that this is where pilots are going. And then, of course, how about misrepresenting or withholding information on written health questionnaire? We found just about a quarter. And this is an interesting question because really the primary way that we screen pilots is by asking them, have they ever had this symptom? Have this ever happened to you? And if they answer no, depending on the level of certification, the screening kind of stops. And an important note is that these are intentionally very conservative numbers. In fact, these are only the people in the study that answered yes. We excluded everyone else that said prefer not to answer. So, and I'll leave the interpretation of a prefer not to answer response up to you, but these are intentionally conservative numbers. But of all the numbers I'm throwing at you, these are the data that I'm most excited about. And there's a lot to this slide, but it is critically important. So in our study, we asked pilots how likely they would be to use a theoretical sanctioned intervention, meaning some kind of approved intervention that could be applied to address the barriers pilots face in seeking medical care. And we divided it into two groups. One is these are the pilots that had participated in unauthorized behavior. These are the people that admitted to going outside the medical system, having a prescription medicine, having a symptom, and not fully disclosing. That's group one. So what percentage of those folks who had participated in unauthorized behavior said that they would be very likely or somewhat likely to use a theoretical intervention? 75%. That's a striking number. But while this number is interesting, I think the next one is the one that I think is most impressive. What about the pilots that answered no to all those questions? Maybe they're young. They haven't had this issue come up yet. Maybe they're healthy and they're lucky. Maybe they didn't tell us everything in the survey. What about those folks? What percentage of the pilots that have not run into this issue yet would be very likely or somewhat likely to use intervention? 63%. So what is this data telling us? Pilots may have healthcare seeking anxiety and they may be participating in unauthorized behavior. But most importantly, pilots want something. Pilots want an intervention to address this issue. I think what these numbers tell us most importantly is that we have an opportunity to partner with pilots, that this could be a collaborative effort in order to forward the effort that we want to see. And most importantly, that 63% shows us that this is meaningful work because of the tremendous impact we can have to help lots and lots of people. So, in summary, we found that about 70% of pilots in our cohorts reported history of healthcare seeking anxiety. We found that about 60% or so of pilots have either delayed or foregone medical care, and we found that just about 50% of pilots had reported history of unauthorized behavior. Now, an important point. What this data means for aviation safety is uncertain. In fact, this data neither supports nor refutes any hypotheses. Now, it can be used for hypothesis generation, but at the end of the day, this data is not really a story about aviation safety. This data is a story about a healthcare barrier, and that barrier's risk factor is being a pilot. So where do we go from here? How does this research fit in a broader research effort? In our group, we are very focused on solutions, meaning we are very interested in generating a quality data product that we can deliver to decision makers to implement the hopeful change and the impact that we want. And from our perspective, we can see that this is achievable through a three-phase strategy. So in phase one is defining the problem. Before we could talk solutions, we need to understand the epidemiology of this issue. Most specifically, it is our hypothesis, and the data is beginning to show that this barrier is not homogeneous. In fact, subgroups within the aviator cohort as a whole behave in different ways. That might be based on gender, socioeconomic status, pilot type, maybe student status, gender identity. And it is absolutely critical that we understand subgroup behavior as we move forward. And this is an ongoing effort that we've had the great pleasure of working with many people, including our colleagues in the University of Alberta, where we just demonstrated similar findings in Canadian pilots. And our group is just kind of transitioning now into phase two, which is trying to understand the qualitative factors that influence healthcare behavior and this perceived barrier. Now, let me start by saying this. There's probably not any easy solution to this issue, because if there was, it would have already been done. And what a partial solution will probably look like is multiple interventions applied to specific targeted subgroups. Now, and the other thought that we have is that most likely pilots have the answer. So in trying to achieve this, we just applied for a $400,000 grant from the Air Force to hire a team of occupational psychologists to conduct 100 interviews with 50 military pilots, and 50 civilian pilots, trying to understand and gather data in a systematic way on three key things. One, what are factors that support the pilot-physician relationship? Two, what are factors that inhibit that relationship and discourage care? And most importantly, three, from a pilot's perspective, what are modifiable factors to that relationship that we can use in prospective research and on possible interventions that we can try to study? This brings up an important point from a research methods perspective about the absolutely different populations that are military and civilian pilots. For better or worse, how the system is set up is that in the civilian sector, really, I know we have fantastic AMEs out there who do more, but really how the system is set up is the AME's responsibility is regulatory. Does the pilot meet the minimums? Yes, no. And really, certainly people do go above and beyond, but really there's not really a therapeutic relationship. Well, that's very different than the military setting, where a flight surgeon has both a regulatory relationship, but also has a therapeutic relationship. So if the answer is no, the flight surgeon can get them to yes. So knowing that, it's important that we study these populations independently. Now, of course, that brings us into phase three, which is taking the factors that we identify in phase two and using them in prospective research. So we can take subgroups within the aviator cohort and we can apply these interventions to generate prospective case control data. So in the end, we can have a quality data product that we deliver to decision makers and say, these are the things that work and these are the things that don't. Knowing that these subpopulations will absolutely need to be in different levels. They will need to be in academia. They'll need to be in the military. They'll need to be in flight training. They will need to be at organizations like ELPA. Because I think we often look towards the regulatory component, but remember, that relationship, that red line, yes, no, is always going to exist. So we may need to be looking at other avenues to achieve what we want. So the time is now for us to come together as a coalition to forward this effort. Because it is really hard to study pilots. And the reason for that is, one, it's really hard to get your hands on them, but two, once you get your hands on them, they are really leery to participate in medical research, which makes for the fantastic catch-22 that is this type of work. But by pooling our resources, pooling our networks, and pooling our momentum, we can make progress on this issue together. And this is one strategy that we could use as a coalition to forward this aim in a way that we can complement each other's work. So, in summary, the challenges we face are huge. In fact, the barriers that pilots face when seeking medical care, in my opinion, is one of the most pressing issues facing modern aerospace medicine. But while the challenges are big, so too is the opportunity for us to do good. Because at the end of all of this is a pilot. And in aerospace medicine, pilots are our patients. And in aviation, pilots are our people. And we're at a crossroads here. And here we can decide whether to partner with pilots, advocate for the quality research and the hard work on this issue, or we can decide to wait. How I see it, I think there are reasons to feel hopeful. You all being here in this conference speaks to that, but most importantly, I think there's reasons to feel excited because we have the opportunity to have a say in what the future looks like, not only in the way that we will work to keep pilots healthy, but also in the way that we will work to keep pilots doing what they want to do, and that's to fly. Thank you.
Well, thank you, Dr. Hoffman. In the spirit of moving along in Beth's timeline here, I will keep my portion short. However, the same enthusiasm that Dr. Hoffman has for this research has infiltrated the university, and myself and Dr. Bierke and Dr. Frantell, who you'll hear from, spent some time working on conducting a very similar data collection that Dr. Hoffman used initially. And so we sent out an initial email solicitation in early October to students and just to see, are the same behaviors, are we seeing the same information coming in that Dr. Hoffman did. And one of the probably the biggest concerns that I have is, are we training this feeling, are we creating this ourselves within the institution, and are we able to change that and change the tenor of our tone? So we had a total of 500 observations, and here was our respondents. Again, very typical of educational research. Pretty good distribution along the all of the majors, recent graduates, seniors. This is pretty normal in terms of response rate for students. And so here's the question that Dr. Hoffman asked of airline pilots, and we asked it to collegiate aviation students. Have you ever sought informal advice, medical advice? And this was 35%, just slightly less, 10% less than what Dr. Hoffman found. And one of the things that we have to understand is two things. One, this was very short-term research. We did this, the initial survey was sent out in the beginning of October, and we had data collected both from prior to John Hauser's passing and as well as after. We looked for group differences to see if there was any difference between the responses. There wasn't, and so this was telling for us as well that that there are some similarities here. Here's the other question related to experiencing symptoms and piloting experiencing symptoms, and you can see here right around 21%. Said yes to that answer. Misrepresenting data on a FAA medical, right around 21% as well. Okay. Now, here's where I think for us, this is where we really spent our time most recently. If there were a resource, if there were an anonymous call line or a hotline or some sort of access to a professional, whether it's a peer support or whether it's a professional that could provide some sort of, even if it's just a short discussion, would that be something that you would use as a student? And 68% said yes. If it was anonymous, completely anonymous, they would use that. And 43 said that they would still use it. 43% said they would still use it, even if it weren't 100% anonymous, but it were a de-identified source. So this is where, of late, the university has focused a lot of attention on providing these sorts of resources. And this is something that's not new to all of you here who have the peer support networks and the availability of these sorts of things. And this is where we really feel like we can make some major changes. Now, we also did some research on some of the more specific details of seeking mental health or mental health help. And this is an area that I'm not knowledgeable and comfortable on speaking on, so I'm going to use Dr. Kary Frantell to present on this.
All right, so one of the things that we looked at was this idea between perceived public, or in this case, other pilot stigma or private stigma. So when we think about this, the perceived stigma regarding mental health, obviously we know, like, what do we think other people think about seeking health care, seeking mental health care? In this particular case, the questions asked students mostly to answer, most pilots feel that receiving mental health treatment is a sign of personal failure. And then other similar questions, like most pilots feel like it would be problematic to seek mental health care. Most pilots think that someone is weak if they receive this care. And then there's the personal or private stigma, which is I would think less of a person who has received mental health treatment, or I believe these things. And overwhelmingly what we found was that people's personal beliefs about mental health treatment were less stigmatized than what they assume other people think. So most people assume that, like, yeah, I'm okay with the idea of seeking help. I think that it's not a problem, but I definitely think that everybody else thinks it's a problem. And in many ways, that's kind of what we wanted to find, mostly because we wanted to be able to emphasize that everybody is thinking the same thing. Everybody is thinking, oh, other people think this is a problem, I shouldn't talk about it. And so most people are fearing that other pilots think about mental health treatment more negatively than they actually do. The other thing that we looked at was beliefs about psychological services. So in this case, it's measuring 3 different things. The first one is intent, or your willingness to seek help if it is needed. The second one is stigma tolerance. So how much are you willing to kind of put up with the stigma that you perceive to be out there? And in this case, that's probably going to be the stigma that you perceive other people to have as opposed to your own. And then the expert aspect. So how much do you believe that psychological services are valuable due to a psychologist or other mental health provider being an expert? You believe that they have skills or training that will particularly help you with this concern. And so you can see the numbers. We really only looked here for means and medians. The higher the score, typically the better. So the one that's more concerning on this list is the stigma. So that's the area that we probably are not surprised. Like, that's the area that people are more concerned about. They want to seek help if they have an issue. They believe that there's merit in seeking help, but the stigma is the part that's really kind of preventing people from doing it. And even when we looked within subjects, so looking at those comparisons between, like, within a single person, which of these 3 things ends up being most significant, and it's the stigma. Overall, like, that's going to be the thing that weighs out for students and for other aviators who are thinking about this. The other major takeaway that I want to emphasize with this, though, is similar to what Dr. Hoffman said, like, that this is kind of the start of a story, particularly because we know when we're thinking about perceived stigma and private stigma, that the perceived stigma that is probably most concerning for students is actually, does the FAA think that it's a problem for me to have a mental health concern? And that's not what we looked at. We looked at other pilots. Do you think other pilots believe this? And even just having conversations with students, my overwhelming kind of anecdotal takeaway is that the belief is, yeah, we're fine with other pilots maybe perceiving it this way until it rises to the level of the FAA. That's who I'm most worried about. And so that is going to become that barrier. And then you see that show up here again in the beliefs about seeking services. So this is part of the story. This is just the beginning part. And ultimately, we want to have a lot more exploration that is qualitative. Looking at qualitative data for what do students perceive is important, what do they think are the barriers, how do we overcome those barriers, and having that very much driven by the students themselves. So I think that we've seen that there's similarities between our data and the data around pilots, but there's developmental differences between college students and pilots who are in the industry, including significantly higher mental health rates and utilization around that age group. And so that's why Emmy and Mateo are here. Thankfully, they are part of the process in terms of us joining together to do research, and specifically us joining together to do research kind of disconnected or outside of aviation, so there's not that like oversight or that feeling of concern that maybe someone else might see this data. So thank you.